Matthew Stanfield is my name. I'm a neurosurgeon and been in private practice for 13 years. I went to medical school and undergrad and grad school all at Indiana University. And then I went out to Oklahoma to do my residency and private practice. And then recently we got the opportunity to relocate here to Seymour. I have 3 children. One is 18 and he'll be going to college next year. And the other 2 are twins that are 10 and they'll be coming here. My wife is, I guess, half Canadian and half Texan, and she was born and raised in Canada, and is looking forward to learning what it is to be a Hoosier. Well, the first thing that brought me here was a summer internship that I did between my first and second year of med school. And I had one of the best summers of my life working, meeting everybody down here. And then I was looking for a place, to start a practice different from where I was at. And I just happened to call up to see if they had any interest here. And it was just perfect timing for them and me, it seems like. And to be coming back to Indiana, there's just so many things that are good about that I can't wait for. It just seems like the perfect location for what I like to do. The majority of what I do is help people with spinal problems and brain problems and peripheral nerve problems. We certainly see a lot of people with neck and back pain. My job is to get them a quality of life where they don't have to take pain medications and they can still do what's most important to them in their life. Neurosurgery really has a lot of different, it doesn't seem maybe as diverse to the outside world, but it's a very diverse field. And the patients that we take care of the most, a lot of neck and back pain. That's the most common thing out there because it's hard to find a single family without a person without a neck or a back problem. So we do a lot of that. And I've really enjoyed over the years, helping the people that have had multiple surgeries already. That's, out of every 10 of them that we see that have had bad back surgery stories, we can usually still salvage 3 or 4 of them, and it's really nice to find the ones that we can still make a difference on with more surgery, because the last thing you want to do is go through more surgery when you've already been through one that didn't work. But it's a complex organ, the spine is, and a lot of moving parts, and it ages, and there's no way to stop the aging. I can remember a young kid that got hurt on a 4-wheeler that couldn't move his leg with a specific nerve root that was injured. And when we did the surgery, we were lucky enough to actually see the nerve root that had been severed and found both ends. We sewed them back together, and it took a while. The first 3 months he still couldn't move anything, but about 6 months later he had full function in his leg. And that was just one little thing that was probably a 1 in 1,000 shot, but it worked, and it was really rewarding to see that. But there's you see all the horrible things in the life, and you also see all the miracles. You see both when you're in this field. So if you're paying attention, you'll see it all. And I couldn't even come up with a best memory. There's just so many people. I can remember one gentleman that was in his 90s who was told in October that he was too old for surgery. 92 years old, but he had a large herniated disc in his neck that was smashing his spinal cord. And in February, I got called from the rehab center by the rehab doctor that he couldn't walk anymore, that he was finally not able to get up with his walker. And I looked at the pictures and I looked at what they had back in October, and I just wanted to strangle somebody because they didn't operate for this guy. And we did, and he walked the next day, and it was amazing the difference. And he was such a healthy person. You don't make it to 92 unless you're healthy to 91 and a half. I mean, it's pretty, and most of those people, age is just a number. I've operated on people, all the way from 16 to over 100. And when you do surgeries for the right reasons and you do them the right way, they really do help people. And that's the nicest thing about it, is you can get people back to work, you can get people to live a life without having to have opioids. I mean, I really believe if I do my job well, then I'll be one of the biggest enemies to the opioid crisis that there is. I love to ride Harley-Davidson motorcycles. I love to ride on the weekends and find small towns with small, mom and pop types of place to eat and go out with a bunch of people on bikes. I love to play basketball, although I can't anymore. I'm getting a little too old for that in some ways, but I love to go to sporting events. If I get a chance, scuba diving and snow skiing, all those great fun things when you go on vacation, I love to do all that. But I think, probably making a Sunday meal at home for the whole family and grilling is probably the most relaxed that I get, other than riding a motorcycle.